We've heard so much recently on the topic of resistance. Can you give us kind of a brief summary of what we do know at this point and what we don't know right now?
Well, we do know that in a few instances, a very few instances, in certain parts of the country, that there are heartworms that are resistant to the preventives. But what we shouldn't presume because of that is that the preventives aren't working. Most are working most of the time and working very well. So the important thing for the client to remember and for the veterinarian to remember is to continue to use the products as directed at intervals year-round.
You've mentioned what we do know about resistance, what we don't know. What kind of information do we need to acquire? What research needs to be done to move us forward in this area?
Well, the question that you would ask me, and you've asked it before, is it in my area? And should I worry about it if it's in my area? And the response that I would give you is we don't know yet. So what do we need to know? We need a test. And of course, what we're working on now is a genetic test so that we can come into Zachary, Louisiana, and we can sample dogs in your area, perhaps shelter dogs, dogs that circulate those stages in their blood that we have access to. We can perform a genetic test on them. I can come back to you and I can say 10% of the dogs that we sampled in your area seem to carry the resistant biotype. So that, in my opinion, is the most important thing on the agenda right now, a genetic test, a diagnostic test for resistance. We can detect heartworm, but we can't detect resistant heartworm using available tests. But with an available genetics test, we can come in, and we're close to it. We're close to it. At Heartworm Symposium, you heard Dr. Pritchard, Dr. Bourgonnet talk about some of the testing strategies that they're developing. And that, I think, will be the convincing blow. It will tell the veterinarian, all right, now I'll know, how common it is. I can monitor it over time. I can determine, whether or not this is changing, With so much travel, pets moving from place to place, adoption of pets. We're in New Orleans. The Katrina issue, the number of dogs that were sent all over the country. So we have mass movement of pets, from region to region. And dogs that are heartworm positive that are carried from one region to the other may introduce one of these evil heartworms, if I can call them that. But then we can go into those areas and say, yeah, it's here, and we can test for it. And I think we're within 5 years of being able to do that.